Hello, everyone. I hope you've had a great week this week. I have chosen cognitive behavioral theory for treatment. Cognitive behavioral theory. The cognitive behavioral theory looks at how an individual's experiences affect their personal thoughts. Beck and Fleming, 2021, states CBT, also known cognitive behavioral theory, is based on the psychological construct that individuals' interpretations of situations influence their reaction, and these reactions are emotional, behavioral, sociological, and more so than the situation itself. This theory can be used for a wide range of diagnoses. Corliss 2024 states CBT is a goal-oriented, short-term therapy. Typically, it involves weekly 50-minute sessions over 12 to 16 weeks. Intensive CBT may condense this schedule into sessions every weekday over 1 to 3 weeks. This approach has a shorter time length that we start to see progress. Effectiveness. Cognitive behavioral theory treats a wide range of mental health illnesses. Trauma that the body experiences can affect an individual's neurological development. Corliss 2024 states, one way CBT may help address this is by modifying nerve pathways involved in fear responses, or by establishing new connections between key parts of the brain. This included anxiety, depression, post-traumatic stress disorder, eating disorders, and substance use disorders. There has been research conducted regarding cognitive behavioral therapy and the brain that shows the effects of CBT. Corliss 2024 states, a 2022 review focused on 13 brain imaging studies of people treated with CBT. The analysis suggested CBT may alter activity in the prefrontal cortex, often called the personality center, and the presensus, which is involved in memory, integrating perceptions of the environment, mental imagery, and pain response. Cognitive reconstruction. This is the modality of cognitive behavioral therapy that I have chosen for my client, Mr. Smith. This is because Mr. Smith had thoughts of embarrassment, uselessness, and does not believe in therapy at first. Corliss states, cognitive behavioral therapy teaches people to challenge negative thought patterns and turn less often to unhelpful behaviors. Mr. Smith, my client, tends to overly pay attention to what other people think about his drinking, especially his children. This has caused anxiety for Mr. Smith. Mr. Smith also has presented with being afraid that other people surrounding him within the community will judge him as well. And cognitive reconstruction can be beneficial to a client who experiences anxiety, such as Mr. Smith, that leads them to believe the worst. Within an article that talks about the technique of cognitive reconstruction, Petrangelo 2019 states that perhaps you tend to overgeneralize, assume the worst will happen, or place far too much importance on minor details. Implementation. Mr. Smith was receptive to this approach. It was easy to plan with the client utilizing this approach. And this approach is goal-oriented, as cognitive behavioral therapy is. This modality is goal-oriented and made it easy to plan with Mr. Smith how to implement the treatment approach. I feel as though just introducing this approach, there was some progress already beginning to be made. Before introducing this approach, Mr. Smith had a very depressing attitude and did not see anything concerning with his behaviors besides showing some embarrassment of his children having knowledge of his behaviors. When planning implementation by journaling his feelings, getting involved in activities surrounding himself with other people in similar situations, he seemed more open and had a sense of hope. Mr. Smith, I believe, began to acknowledge that there was an issue with his drinking, and he also found it easier, the plan to help him express his emotions, as his emotions were what was contributing to his excessive drinking and to his depressive symptoms. And utilizing this modality really helped provide an opportunity for him to express and work through in therapy sessions his emotions. These are the references utilized within this presentation today. Thank you all for listening, and I hope you have a great week.